Ozanimod induction and maintenance treatment for ulcerative colitis. But first of all, we are going to say the definition of an ulcerative colitis. It is a chronic relapsing form of inflammatory bowel disease that causes inflammations and ulcers in the colon.
What is ulcerative colitis? Ulcerative colitis is a chronic condition characterized by inflammation and sores or ulcers in the rectum and colon or large intestine. Ulcerative colitis can be distinguished based on how much of the large intestine is involved. When ulcerative colitis involves only the rectum, it is referred to as proctitis. If the left side of the colon is involved, it is known as left-sided colitis. When the entire colon is involved, it is known as pancolitis. Ulcerative colitis is characterized by periods of time with active inflammation when the patient is experiencing symptoms, and periods of time when the inflammation is turned off and the patient feels well. We call these periods of wellness remission. Many patients with ulcerative colitis have long periods of remission, alternating with periods of active inflammation, which are called flares. Some patients with ulcerative colitis have more severe flares than others.
The ozanimod RPC-1063 is an oral agonist of the sphingosine 1-phosphate receptor subtypes 1 and 5 that induces peripheral lymphocyte sequestration, potentially decreasing the number of activated lymphocytes circulating in the gastrointestinal tract. This study was double-blind, placebo-controlled phase 2 trial of ozanimod in 197 adults with moderate to severe ulcerative colitis. The patients were randomly assigned in a 1:1:2 ratio to receive ozanimod at a dose of 0.5 milligrams or 1 milligram or placebo daily for up to 32 weeks. In the Mayo Clinic score used to measure disease activity on a scale from 0 to 12 with higher scores indicating more severe disease. The primary outcome was clinical remission at 8 weeks. The clinical response at 8 weeks occurred in 57% of those receiving 1 milligram of ozanimod and 54% of those receiving 0.5 milligram, as compared with the 37% of those receiving placebo. At week 32, the rate of clinical remission was 21% in the group that received 1 milligram of ozanimod, 26% in the group that received 0.5 milligram of ozanimod, and 6% in the group that received placebo. The rate of clinical response was 51%, 35%, and 20% respectively. At week 8, absolute lymphocyte counts declined 49% from baseline in the group that received 1 milligram of ozanimod and 32% from baseline in the group that received 0.5 milligram. The most common adverse events overall were anemia and headache.
Although the cause of ulcerative colitis is not known, many factors can contribute to a person's risk of having ulcerative colitis, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes the inflammation. Environmental factors may include infections, smoking, and taking antibiotics or nonsteroidal anti-inflammatory drugs, or NSAIDs. In ulcerative colitis, inflammation appears within the colon, and the immune system works to combat the bacteria and viruses as it does with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it rids the body of the bacteria or viruses, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of ulcerative colitis.
In this preliminary trial, ozanimod at a daily dose of 1 milligram resulted in a slightly higher rate of clinical remission of ulcerative colitis than placebo. The trial was not large enough to establish a clinical efficacy or ACEs safety.
Inflammatory bowel disease can cause inflammation in the small and large intestine. In other words, inflammation of the bowel. Colitis refers specifically to inflammation in the colon, or the large intestine. Ulcerative colitis is a type of inflammatory bowel disease that tends to form ulcers along the inner surface or lumen of the large intestine, including both the colon and the rectum. These ulcers are spots in the mucosa where the tissue has eroded away and left behind open sores or breaks in the membrane. Sometimes there's a flare, which means that new damage has occurred, and then there are periods of remission when the tissue starts to heal up. Ulcerative colitis is actually the most common type of inflammatory bowel disease. Not that there are that many, but this one causes inflammation and ulcers in the mucosa and submucosa of the large intestine only, which is an important point that sets it apart from Crohn's disease, another inflammatory bowel disease.
Treatment for ulcerative colitis varies depending upon the needs and responses of individual patients. There are a variety of treatment options available today. The following video outlines a typical course of treatment for ulcerative colitis. The information within may not directly apply to your child's case and is intended for educational purposes only. The specific treatment plan should be developed by your child's physician with your input.
Everyone is unique, and UC may require a combination of approaches. Sometimes, doctors will have you do a combination of treatments to see what works best for you.
When a patient who has inflammatory bowel disease is having symptoms, typically our first goal is to get their symptoms under control as quickly as possible so that they can return to their normal life. When patients are first diagnosed with ulcerative colitis, their disease is usually active. And in those cases, we often use more potent medications to treat their disease. Sometimes we call them induction agents. For patients with more mild disease, we can often treat them with aminosalicylates. For patients with moderate or more severe disease, we'll use steroids like prednisone.
It works very rapidly. Usually, most of our patients are feeling better once they're on prednisone within a week or two, sometimes within even a few days. But because prednisone has side effects, we typically use that medication for a short period of time, and then we start backing off and introducing maintenance medication, the sulfasalazine or the mesalamine. That's a very effective, very safe medication.
In general, medications that are more effective in controlling inflammation also have more side effects and require closer follow-up.
For patients who flare up on the mesalamine, we typically will use an immune modulator drug called 6-mercaptopurine or azathioprine.
In most cases, maintenance medication should hold a person's disease under good control and keep them at their normal level of activity. But there are going to be times when disease activity increases, and in those cases we may use, often for a short period of time, rescue medications. These are medications meant to bring their disease activity under control and to a level where maintenance medications can work again. If we find that a patient's symptoms aren't improving as we had expected, that might mean that a different medication is indicated. In those cases, we may use infliximab, cyclosporin, or tacrolimus. The long-term goal is going to be to put in place a treatment plan that's going to keep their disease in remission for the longest time. In some patients, the inflammation in the intestine doesn't respond to our medications or loses its response to our medications. When that does occur, we often consult with a surgeon and discuss the possibility of removing the colon. He didn't really respond fully to the tacrolimus that we had placed him on. And now, several months later, we find ourselves treating him with yet another course of steroids. And I'm just not optimistic that we're going to be able to manage his disease just using medicines. It's very important for children who have ulcerative colitis to be seen by their physician on a regular basis.
But I'm just going to take your temperature and your blood pressure.
This gives us an opportunity to perform physical exams, make sure they're gaining weight, and make sure that their inflammation is under control. The second thing it allows us to do is to check for any side effects of the medication. Now, the medications that we use for ulcerative colitis are actually quite safe. However, they do have some side effects.
All right, 20 milligrams. Now you're only taking it in the morning. You used to take
Our goal in treating patients with ulcerative colitis is to use medical therapies to control the inflammation. And in doing so, we make them feel well and maximize their quality of life. They return to school, they return to social activities, they return to their routine.
Therapy for ulcerative colitis is constantly improving. There are additional resources and links on this DVD to help keep you current. Additional information can be found at www.childrenshospital.org/IBD and at www.ccfa.org. The information provided in this DVD is intended for general education only. Your physician will work with you to develop a specific plan for treatment.